Hi, I'm Dr. Wendy Besler. I'm a PGY2 from Detroit Authority Health, and I'm a psychiatry resident. And today I'd like to share an incredible story I feel is incredible that actually took place in the psych unit when I was doing my psychiatric rotation on the inpatient unit. I had this amazing case that was presented, which was a 49-year-old African-American female coming in through the ER with a known history of schizophrenia. She had been diagnosed at the age of 21 and had been on multiple different medications. She was refractory to all of these medications. She continued to have periods where she might do well, even enough to get a job, but then would continue, unfortunately, to have hallucinations and paranoia that could be quite severe. Sometimes she would even be verbally violent. When I first saw her, she was actually now on the medical floor because she was in 4-point restraints due to staff being concerned for their own safety. The most amazing thing is when I saw her, she actually had episodes of complete lucidity. So at one moment, she would be telling me how not to go near the window because something was going to grab you if you went by the window. And within a couple moments, she was completely lucid. She would be able to look at me directly, apologize, say she didn't know why she said the things she did, and then with another couple of seconds, she was back having another hallucination. It was quite amazing and obviously did not fit the criteria for schizophrenia, which is what made me look into this case a little bit further. But even before I could do that, she had a very unusual episode. While I was standing there, she suddenly became unresponsive to verbal and physical stimuli. Her eyes elevated and she stared at the ceiling for a couple of moments. She was literally having a seizure before my very eyes. The only reason I had that knowledge base was because I've been a PA for over 10 years in neurology, and I had recognized seizures like this before. I immediately called for a stat EEG, but unfortunately, the tech did not feel comfortable doing a stat EEG because he was afraid she was going to pull out the leads, even with restraints in place. By 2:30 in the morning, I got the call that she now had a grand mal seizure. It was incredibly upsetting, but it also allowed me the greatest opportunity to actually get full imaging study. We got an MRI of her brain, and I sat and watched these images come up as she had the actual MRI. And amazingly enough, there was the large Dawson finger, which is a perpendicular lesion to the ventricle, which is highly suggestive of MS. I saw that, as well as multiple white matter lesions that were scattered within a very specific area of the brain, specifically the temporal lobe, that could have easily been causing her hallucinations. She had the diagnosis of schizophrenia for over 28 years. When she came out of the MRI, she had a lucid moment, and I had the opportunity to ask her, did any family members that she know of ever been diagnosed with MS? And she said, yeah, my mom. My mom died at 29 with MS, but I don't have to worry about that because I have schizophrenia. This is so incredibly important in medicine today, and especially as a psychiatry resident, to be able to recognize the differential diagnosis when a patient presents with a long-standing psychiatric history, to understand that just because you have a psychiatric diagnosis does not mean that you can't have a different medical problem altogether. In this particular case, I don't believe she ever had schizophrenia. I believe she always had MS, but unfortunately, it was missed and not treated appropriately, which is absolutely devastating to her, her life, and her entire family. But having the opportunity to be able to change somebody's life is probably the most amazing privilege anyone could have, especially as a physician, because that's why we actually went to medical school. Thank you.